let's talk about another disease or another type of disease, which is the fungal nail infections. Fungal nail infections are very common infections of the fingernails or the toenails. So because of they cause the nails to become discolored. The nails lose their colors, then they become thicker, and they are more likely to crack and break. Now, infections are more common in toenails than in fingernails. Now, the technical name for a fungal nail infection, the technical name we call it is onychomycosis. Onychomycosis. That's what we call the fungal nail infection, onychomycosis. Now, what causes fungal nail infections? What's the causative organism of fungal nail infections? It is caused by various fungal organisms, and the most common type of fungus or fungi that causes this infection are the dermatophytes. Also, it can be caused by yeast, can be caused by molds, and it can even also be caused by bacteria. Bacteria also causes some nail infections. We are talking about fungal nail infections, and it's most commonly caused by the dermatophytes. Now, what's the mode of transmission? How does a person get a fungal nail infection? Now, they can be caused by different types of fungi that live in the environment. Now, the way they affect us is that they get into the small cracks in the nails, the surrounding skin, and they enter the nail and they cause an infection. So that's the way a person can get a fungal infection, through the small cracks or the surrounding skin around the nail, and they get into the nails and they cause a fungal infection. Now, what are the symptoms of a fungal nail infection or fungal nail infections? The nails that have been affected by fungal infections, they become discolored. Now, obviously the normal color of nails are white or sometimes almost even colorless, but when they become discolored, they could either be yellow, brown, or white. Now, the nails also become thick. They become thick, then they become fragile and crack easily, or they become cracked. Also, a fungal nail infection is not usually painful until it becomes severe. So that's another symptom. It could be painful, it could become painful, but it's only in severe cases. Now, what is the treatment for fungal nail infections? How can we treat fungal nail infections? Now, fungal nail infections are usually very difficult to cure, and they typically don't go away until we apply antifungal treatment. Now, the best treatment for fungal nail infection is usually prescription of antifungal pills, and we take them through our mouth. Now, in severe cases, the doctors might remove the nail completely. It could take several months or a year for the infection to completely go away. So, normally the treatment for fungal infections is taking of antifungal pills or drugs, and they're taken in by the mouth. But in severe cases, they may have to take off the nails, remove the nails completely. And even after this, it might still take several months or about a year or two for the infections to completely go away. Now, what is the prevention? How do we prevent fungal nail infections? One is to keep the nails and the hands and the feet also clean and dry. So keep your nails, hands, and feet clean and dry always. Then clip fingernails and toenails short. Clip them and keep them short, and also keep them clean. That's another way to prevent these fungal infections. Make sure your nails are not too long, and also they are clean, both the toenails and the fingernails. Also, another method of prevention is do not walk barefoot in areas like locker rooms, public showers, dirty places like that have public places like that have like a lot of people have access to. So don't walk barefoot in places like that. Also, do not share nail clippers with other people. The person could have a fungal infection. Also, when visiting a salon, maybe we're going for a pedicure or a manicure, make sure the equipment are sterilized, or you could even come with your own equipment, more preferably. So those are ways to prevent fungal nail infections. So some other diseases that we have that are caused by fungi include onumadu, which is caused by dermatophytes, which are filamentous fungi that grow on the hair, the skin, and the nails. And it is spread by direct skin contact. And what we notice when we see this disease is a characteristic rash, mainly on the groins and the fold of the buttocks. So that's the symptom, a rash that's found mainly on the groin and the folds of the buttocks. Then the athlete's foot, that's another disease caused by fungi. Also, the pathogen is the dermatophytes, and is spread by direct skin contact. And the symptom is itchy or smelly patches between the toes, maybe smelly foot or smelly toes. Those are symptoms of athlete's foot. So with that, we've come to the end of today's lesson and this topic on diseases caused by microorganisms. See you in our next.